What's up, guys? It's Matt. Yeah, it's been a few weeks since my last little car vlog. Sorry, I've been wanting to try to do one at least every 2 weeks, but just the 5 day a week schedule has been pretty intense. And then, then I got the cold that was going around. I'm still trying to get over that a little bit. And sick kids, my wife was sick, so just a little preoccupied. So sorry for not shooting something a little sooner. So I'm just leaving campus right now. So basically, just to kind of recap the last couple of weeks. I had my NICU rotation last week, and as far as clinic goes, and I enjoyed NICU a lot. Had a couple of good therapists, and that I got to shadow, and it was really, really awesome. It was a really cool experience. So I'm looking forward to get back to the NICU. I don't know if I'll get another full week in the NICU, but just because of the way the schedule's kind of worked out, having 4 people. So, and then this week, Monday and Tuesday, I was in the pediatric ICU again, and it was I think better this week than it was the first time I went through. You know, pediatric ICU is kind of like adult ICU on just smaller people, basically. A lot of the therapies you would do are the same. A lot of your normal values are obviously different, blood pressures and heart rates and all of that. And then a lot of the disease processes are a little different. So it's RSV season, so there's a lot of little babies, little kids with RSV. And then, some of the congenital heart defects babies who they reached the age where they were old enough to get some of the stuff worked on. So one of my patients had I can't remember if it was the ductus ovale or whatever, or if it was a patent ductus arteriosus or something, but he had a cardiac surgery and then wound up getting RSV too. So we were able to do his therapies and stuff. So it was a good experience. And then as far as class goes, I finished up PALS. So we actually tested last Friday, and I am now PALS certified, and so that's the Pediatric Advanced Life Support. And then this week we pretty much just talked about common modalities for treatments and oxygen therapy on kids. And again, a lot of it carries over, kind of the same from the adult world. I think in kids you see a lot more continuous therapies and stuff. So we were able to look at some of the continuous neb setups for the mini hearts, and basically or the giant, canister looking continuous acorns, and just different ways to set those up, and also just little tips and tricks for setting up on little kids. I know it can be tricky sometimes, especially in an ED setting, if they're getting a breathing treatment for something and they want to sit certain ways that make them more comfortable or whatever, and it's hard. If you have a treatment directly attached to a mask, or an adult who can just sit in Fowlers or high Fowlers or whatever, versus a kid who wants to lean over this way or turn or lay around. And so just the tricks that you can do with the tubing that allows you to still give the treatment, and that it still nebulizes properly. So there was that. And then in class today, we went over more stuff, hyperinflation therapies, and we did a lot of CPT therapy stuff today, which again is not a whole lot different than the way you do it on adults, as far as the positions and even the same outcomes and when to stop therapies, identifying an adverse reaction to your CPT or whatever. So all in all, that pretty much gets us caught up to where I am right now. Yesterday we did have a baseline practice clinical simulation exam in my review class. I wasn't there for that class because my daughter was sick, so I didn't get a chance to participate, but I talked to my instructor today, and he's going to go ahead and send me the link. Kind of like our practice TMC, it is a like non-secured, kind of older set of sims. I had probably like 2015 unsecured sims, and I think there's 16 of them. So he's going to allow me to do those at home, and a bit of an honor system. So basically open up the link. It's not for a grade or anything. If anything, I told him I just really want to know where I stand. So I'm inclined to not necessarily, take extra time or look up answers when I don't know what a test is or whatever. So I want to see where I am right now and really create a legitimate baseline for myself, so I know what I need to work on. So I'm grateful for that. And it seemed like everyone did reasonably well, versus the average. So I don't think anyone passed. So I doubt I'm going to pass either. But you never know. So that's pretty much where I'm at right now. So again, yeah, sorry for the long time between updates and stuff. It's just hard to sit down and find time to record. Even when I was at home yesterday, it's like my daughter was sick. She wasn't napping very well, so I mean, any reasonable expectation I could sit and record at home and then still have time to get all the editing and everything done is just daunting. So it's easier to shoot in the car. I still haven't bought a thingy yet. I promise I will figure that out. Muster up the $9 or whatever it is to buy a new mount for my car, so I don't have to go ghetto here and hold it. So anyways, guys, I'm gonna go ahead and stop it here. As always, guys, I hope everyone's doing well. I hope your semesters are going smooth, your clinicals are going well and everything. And if you have any questions or comments, like I said, always feel free to leave a comment below. I love talking to my fellow students, and I love learning about how other programs work. So, if you guys are doing something different than mine or whatever, like I said, just comment. I do always love talking to people about respiratory. So, anyways, guys, everyone take it easy and have a great day.